30 or 6, Surabhi would take her grandmother downstairs and leave her there. So neighborhoods help you, communities help you. Those elderly women didn't know what her problem was, but they knew that Namita has, concern for her, Surabhi has concern for her Dadi, and all of us will sit and look at her. So I think even simple local initiatives become very, very effective. And this is a strength of our Indian society. So, let us not only think of hospitalization and care homes, etc. Patients with Alzheimer's can stay with us in our homes, and they can be looked after and things can be done. The other thing is, you showed the insensitivity and lack of concern of the health sector. So, this is where I think Dr. Desai can tell us that the health sector is also now changing its worldview somewhat. At least there's the beginning of it. So it's not just physical diagnostic health and surgery and change. It's not just organ transplants, etc. They're also focusing on psychiatry. Psychiatry has become quite huge, and it's oft pursued by voluntary choice by a lot of doctors. We have lots of parents of doctors also sitting here, young doctor students or doctors, and many of them willy-nilly choose psychiatry as their specialization. So I would like to leave this on an element of hope. And I think we can do a lot in all our teacher education programs. I'm sure Ashish, Sunil, all of you agree with me. Okay, in all courses of undergraduate programs, we have very modern forms and representations of how our BA programs are now structured all over the country. There is a lot of scope to have sensitivity and awareness training and building on themes of this kind. So I think, the first thing is sensitivity, awareness, and telling people you don't need an expert only, you can also do something for this cause. You can be the participant in this cause, would also infuse a sense of responsibility. So I think we can make humble beginnings. NFDC has wound up, is it? They used to earlier give lots of grants in aid for making films of this kind. National Film Development
They are also
Corporation.
interested in commercial cinema.
No, but I'm sure we can negotiate with the INB ministry. I'm not so negative in my orientation.
I'm not negative, I'm just saying what my experience
A
has been.
film
since
like
5-6
this,
years.
I think it should be shown in the parliament, I think. Next time, next session of the parliament, if we showed this to our honorable Prime Minister and, his ministers, to everybody, all the members of parliament in the Lok Sabha and the Rajya Sabha, they would feel compelled to take it up. So it's about, finding the window to do that.
I fear I keep talking about showing it.
Ma'am, quickly, I just like to add one more thing.
Please.
Dementia, offset of dementia, now we have the facts like, now we have offset like of dementia is around like, we have seen patient of 40 years, 42, early offset of dementia. Though now this is not only a old age problem. It's the kind of lifestyle we are living,
That's right.
whatever the problem is. But now we have seen early stages of dementia also.
Tongue in cheek. When I was a young psychiatrist, there used to be this joke, and I believed it then, I believe it now. And I've never seen an old age alcoholic because they all die early. But jokes aside, the technical point, friends, is that pre-senile onset dementias, I think fortunately, forgive me for that view, have very short lifespan. So they are terrible, they are melodramatic, like you showed very well, but for good or bad, the pre-senile, pre-50 or 55, 60 dementias don't live long. So while that is a problem, and their medical care and health, social care is an issue, really the issue is about the elderly population, And if I might say what Namita said, see, also please relax. I spent 40 years in the public sector before, the society and the government system didn't need me. When are you old? But I look back, and every day, every night, every week, I wonder, we have too many marginalized population groups. And as we were discussing, this population dividend is a big BS. since the 80s and 70s. By 2050 or 2055 or 60, you're going to have a serious problem merely in terms of that population bulge going up. And if you really look at all the marginalized populations who need either family-based care or temporary hospital care or social care facilities, it's going to be a very adverse situation. Don't get me wrong, there is a whole lot of healthcare and social care benefit that can accrue, and the humanism that South Asia and Afro-Asian societies have is still a blessing, a silver lining. But the reality is bad. Let me just clarify one more thing, not as a defense at all, Namita ji. World over, and certainly in this country, by government rules and by science, and the rules of business that got enacted soon after the independence, healthcare, please realize, there is any issue, ophthalmology, orthopedic, hearing, mental illness, healthcare, diagnosis, treatment for short, is the health sector. Everything after that is the social sector. Be the government social sector, MOSJ, or NGOs or civil society. So one will also have to realize that, and like I said, so this is not about defending health sector, but health sector by all models, legal, social, ethical, scientific, is about the short-term care diagnosis. Everything else will have to be the social care model. It may come from any sector. So we'll have to somewhere really do that almost unworkable idea. I was saying to Namita, allow me to share this. Homeless mentally ill people we started working with in about 2000. There were people in Bombay, Chennai who were working in Calcutta, no, after us. Even before that, in the 80s. My friend Bharat Vatwani, who got the Magsaysay Award in 2017, can you believe? As a clinical psychiatrist, he and his wife both, they started a shelter home for homeless mentally ill in 1985. And so his Magsaysay is absolutely justified, you know. The point I'm making, friends, is that the Delhi High Court and the Supreme Court has a whole lot of public interest litigations going on. Some concrete action happens. There was this order in 2009 by the Division Bench number 1, Justice.
Entirely on the caregiver's perspective. What is it that the caregivers need, the ecosystem that they need, so that their life can be enhanced, and obviously thereby their care for their loved ones can be enhanced. And there is so much going on. There are so many dementia care homes, daycare, residential support groups. One of them I know is being run by the lovely Dr. Jayashri Dasgupta sitting over there. Thank you for coming, Jayashri. She's running one in Gurgaon. So there are so many of them, and I have visited quite a few of them in India, across different parts of India and in Gurgaon, and they're doing a fantastic job. So I think maybe those were the old days when we used to think, and sorry to use this term, but ABAS, what we used to be called the Chadre Ka Pagal Khana, that's how people used to look at it. Then all that is changing. It's changing, it's not completely done, there's a long way to go. But there is so much going on. You talked about caregiver training, so much is going on. And in little pockets around the country. And this is where we, the Dementia India Alliance, if I may mention, we have just come into being a year ago. We are bringing all these different small elder care homes and support services together, and are doing advocacy work with the government. We've met the Ministry of Social Justice. We've got a, you'd be very happy to know that in the state of Karnataka, dementia has been declared a healthcare priority. NIMHANS, the government of Karnataka, and the Dementia India Alliance are actually working together to prioritize dementia. And our vision, we have so many things we want to do. One of the things we're trying to do is also to make it a healthcare priority in NCR, working very closely with ABAS. Dr. Nimish, you'll be happy to know. And many other things like that, training the trainer, building a whole body of trained caregivers, attendants, nurses, healthcare professionals across the country who understand what dementia is and can take care of a dementia person, because it is an unforgiving job, and the attrition rates are so high in caregiving for dementia. Sometimes they don't even last one day.
And those pockets do not touch the lower middle class or even the middle class. Forget the lower homeless. Okay? And if I might just say last, sorry, Vishal. You know, of the three characters who had dementia, which one does my heart bleed for most? The guy who died. So realize that, please. Every story is an important story. Every person has a right.
So quickly,
So, oh, sure.
quickly, I just like to add my few points about this. See, there are a lot of things happening. You know, the way how these things are happening. You know, like suppose, can you hear me? Hello, can you hear me?
Yes, yes.
So the thing is, for say like per se this thing, you know, this the whole civil society movement about dementia and all that. So there should be, this is not a any like cancer, all fatal diseases like dementia, cancer or other any health challenge should not be treated like a it's my brand. Like suppose I made a film on water, so someone started calling me Waterman of India. This kind of things, actually affecting the whole issue of that, the domain. So when I started working on farmers, they started calling me farmer man of India. So I till my 18 years of career, I avoided that. I go in isolation. I talk my subject and go in isolation. But the thing is, right now some of us dealing serious health challenges as a brand of something. That is going on in Europe. There are some people who will avoid you. All Indian initiative they will avoid. Because they are the known brand on that domain. So this is something I'm thinking of. Second thing, see the character I have shown in the film about the rural character. So most affected population is rural population, abandoned elderly population we have. We are going to be the largest abandoned elderly population in India. Second thing, we have largest broadcasting system, like and radio, television programs and all that. So these kind of things we need to think about it. And it's not about any minister or we are opposing any minister or any government or anything. What is my job if I'm a filmmaker or any media person or person or from academia or whatever? I'm just
Good faith is important. What we haven't let, in fact, नीना जी at all talk much. I'm so sorry. All our apologies. नीना जी ने जो सवाल उठाया था, we have argued this a lot. What about the rights of the carers? Right of the persons affected. You see, the international law only talks about the right of the person with disability, including dementia. But what about the right of the family-based carers? Gradually, what happens is what I mentioned. People will willy-nilly try and put them out. And say, yeah, if my rights are not respected, if my own life is in danger in trying to look after that person, I might as well go and put him or her in a home or let him or her be on the street. So at one level, the dilemma is really about to what extent do we want to copy-paste international legal framework? And laws affect care facilities.
I just
Ma'am.
feel that we should sensitize the caregivers with a more, the human approach, not mechanical that how that's going to affect me and my mental. They have to be mentally pretty strong. The caregivers have to be patient. They have to have certain qualities of caregiving. Patience is number one. Because I've seen they're very impatient and they're just kind of, ward off the elderly, and the elderly gets even more disturbed. They get mentally more
That's
disturbed.
human too, right? I mean, I love the idea that you showed the neurologist with developing
Exactly.
I know, exactly.
Out of reality, you are part of it.
Yeah, exactly.
Any one question that you want to ask, one major question, anybody from your
We're sitting in Lodi College, Dr. Saab. What is the definition of subhuman? What is your definition of subhuman?
I described to you the NCW study
The
of
example you gave.
No, 2007. And what she reminded me of what mental hospital Shadra was.
I ran into Vishal next door in the India International Center. He had screened. And I said, this is not the way to screen your film. There were 5 people in the whole hall.
Was it screen there?
It was screened there, and there were 5 people in the audience. The whole hall. I
My
said,
No,
God.
at least,
Don't. ज़्यादा थे. You see, my fear was that the weather.
I know.
It happened. The rain. There was a program before this which got delayed because of the rain. We couldn't help it, but at least we got to do this. Now our society, there are people who are out there who want to tackle and discuss and put the issues like this, which are very relevant to today's society. We are all getting to the age of 90, 95, where you read the obituaries these days, born in 1923, born 19... I myself am 81 now, but I come here, I run this alliance, that's it. But we have had 2
Excellent.
members of our governing body suffer dementia, and they lived on several years, but we lost them. One of them only 4 or 5 months ago. It's a real issue. All of us have them in our families, and we used to lock up the old person because they run off, they get lost, they take off their clothes, they're pagal ho gaye ji, and so on and so forth. But the issue now is getting more and more attention, and you have brought out, all of you you have immense knowledge and experience. And thank you very much. You shared. Yeah, I think the batteries are running out. It's 9 o'clock. Thank you for sharing your very, very valuable knowledge and experience. We really appreciate it. And thank you, audience, for making it on such a rainy, difficult day.
Very nice.
Thank you. Thank you, everybody.
You should have more question and answers.
Okay, guys, I am going to have to rush. I love to say more hello, but I'll rush.